Well, howdy YouTube family and Merry Christmas. It's Bolt CRNA coming to you again with another day's topic. Today we're going to be talking about COVID crisis rates. So a lot of you guys have been hitting me up on Instagram. You can go follow me over there. It's Bolt CRNA on Instagram, and saying that you're getting these rates for like crazy amounts of money as bedside COVID nurses. Let's talk a little bit about the details into that. Let's get into it. So as we all know, this third surge has hit our nation, and as this has been happening, hospitals are across the nation realizing they are short on nurses. They need nurses, and not just any nurses, but they need nurses who can take care of COVID patients, who know how to handle respiratory issues, especially who can do ventilators. So they're needing ICU nurses, mostly critical care nurses. So yeah, you're looking at them hitting up critical care nurses with crazy rates. I saw an article saying that they're getting $6,000 to $8,000 a week of salary or of pay to do this job temporarily, to do these temporary contracts. So a lot of you guys are looking at that and be like, wow, that is awesome. And you should be celebrating, because that is good money. Nurses are making great money right now if you're doing these COVID crisis rates. There is another side of this coin though. So after you're done celebrating and saying woohoo, you know, they're actually paying you pretty much good money, what you should be getting paid to do what you're doing. Let's talk about some of the risks and some of the other side of this discussion that you need to be aware of. Essentially, this is hazard pay you're getting, as you should be getting hazard pay. But remember, this is hazard pay. This is not them just offering you up tons of money just because they really appreciate your skills as a nurse. You're going into a very high risk, dangerous position. You're going into a place where you're going to be surrounded by COVID positive patients who are actively shedding the virus. You're going into an area that's going to be short staffed, that's going to probably have less PPE than maybe you need. Or even if they have the PPE you need, you're going to be stuck wearing it all day long. All of us who have taken care of C. diff patients and things like that know that how miserable it is to go into a room and be wearing a full, gown that's trapping in all this heat, these plastic gowns you wear all day. And then with COVID, you're wearing an N95 that restricts all of your airflow, so it's hot around your face. And then you're wearing a face shield over that, so all the heat from your face is just radiating around your face. You're pretty much sweating and miserable all day and uncomfortable in these situations. And at any point, if you take this PPE off, you will be exposed to a deadly virus that might kill you and has killed hundreds of thousands of people at this point, some of which are healthcare providers who are doing exactly what you're volunteering to do. So when you're looking at these pay rates and being like, wow, this is awesome, we're making great money, realize this is kind of like when soldiers get special incentive pay to be deployed to like forward operating bases in Iraq and stuff. This is what happens. This is what should be offered to you when you're taking on these kind of risks. Another thing you need to remember is you're probably not going to be working 3 12-hour day shifts like you're used to working as an RN. These COVID rates, they're going to be short-staffed, they're going to be desperate, they're probably going to be, with these kind of pay rates they're offering, these are probably like 60-hour-a-week contracts. They're probably expecting you to work long days. You may be rotating night shift and day shift and covering longer days than 12 hours. They may have you working 5 12-hour shifts in a row and maybe longer. I've heard stories of some nurses who have done these long-term, high-pay contracts saying that you're just worked like a dog, and to the point where you're just totally exhausted, which will bring down your immune system in general and make you more likely to be susceptible to infections, virus, things like that your body naturally would fight off. You're going to have more trouble with now, because you're going to be exhausted, you're going to be sleepy, your body and your immune system will take a hit with this kind of workload. So yes, while I think it's awesome that they're getting paid good money, and I think they should get paid good money, there are definitely other sides of this discussion than besides money that you should be really considering with this. Another aspect of this discussion, and why I got involved, I guess, is because I've had a couple people make little commentaries to me, like on Instagram, saying, hey, with this kind of salaries, we're making what CRNAs make. Maybe we should just do this from now on and not go to CRNA school. That is totally apples to oranges kind of discussion, and I'm really shocked that anyone would even think that. And these are the few reasons why. First thing, going to CRNA school is not about money. It should not be about money for you. If it's about money, please stay at the bedside. Going to CRNA school is about investing in yourself, in your education. It's about having the goal of wanting your doctorate. It's about having the goal of wanting to enrich your education and your knowledge and your skills and your abilities to care and manage patients and treatment. That's what going to CRNA school is about. So if you're doing it just because you want a more hourly per, your money per hour or your salary per year will increase and that's your main driving factor, please don't go to CRNA school. Second thing, the earning potentials as a CRNA are much greater than that of an RN, pandemic or not. The reality is our base rate pay for normal hours in a normal environment is pretty much what you're looking at getting paid working 60 hours a week, risking your life with a deadly virus. So those are two very different situations. And so yeah, our hourly amount of work that we put forward and the type of work that we do in the labor intensive work that you're thinking of doing as a bedside RN, I did it for 4 years. I know very well what it feels like and what it is to do that. They're completely different stratospheres from being a CRNA and being an anesthesia provider. The manual labor is totally different. There's very minimal manual physical labor that I do as a CRNA. I lift the head when I'm intubating, and when we move patients from stretchers to OR tables, the rest of the staff are moving the body and I'm picking the head up. The heaviest part I move is the head. So yeah, it's different. It's a very different thing. What I'm responsible for, like mentally, the physical stress, the mental stress, I mean to say, is very much more as a CRNA than it is as a bedside nurse. But as far as like slaving away in a isolation gown with a full visor and N95 on in a room for 12 hours, turning patients and cleaning them and doing ventilator care and oral care and all these things for the rest of my career, that's totally different from what I do as a CRNA. So that's a different aspect you should be considering too. So all in all, I say all that to say I am elated that nurses who are bedside COVID nurses are getting paid well. That's awesome. They should be getting paid well. I think the ones who didn't get paid well back when the pandemic first started should get back pay. There should be incentives and stuff for all frontline healthcare workers. I don't want to get this twisted and imply that the only people out there who have had a hard time or been at risk are bedside nurses. Lots of people out there in healthcare have been at risk. I do think bedside nurses have taken the worst brunt of it, and just like historically, nurses have always been the martyrs who have been pretty much thrown out to be lambs to the slaughter first in line. They have had that same experience, I think, through this pandemic. So I do believe that they do deserve good salaries and incentive pay. But remember, this is temporary. The COVID vaccine is being distributed out now. They're planning to get this thing under control and have a different, healthcare landscape in not too distant future. So this salary and these pay rates for these temporary contracts as COVID bedside nurses, these are temporary. These are not the rest of your nursing career. This is what you're going to get paid. This is a temporary thing. Take advantage of it if you want to risk the virus and your life. Take advantage of it now while you can get a lot of money, maybe save it up to pay for CRNA school or something. Also, don't think that you need to jump on this. If somebody's telling you this is a critical thing that maybe could kill you to do this, don't jeopardize your life for $6,000 to $8,000 a week. Save your time and go to CRNA school and then just make that working a safe, normal 40-hour work week as a CRNA later on. Don't think that you need to jeopardize your life to make that kind of money right now in short-term contracts. If it's worth it to you, then do it. But of course, long-term, remember your earning potentials, your salaries, your job satisfaction, the physical work of your job is very different as a CRNA, and it's going to be much better for you as an anesthesia provider in the future. So I would say if your plan was to go to CRNA school and that's something you wanted to do, but you're suddenly seeing these pay rates and thinking, oh, maybe I should stay around and do this for a while, that is extremely short-term thinking, that's only looking at one side of the equation. There's a whole other side that we just discussed that maybe you didn't really think about. Well, all right, guys, that was what I think about short-term salary rates for pandemic RNs. I want to hear from you guys, the ones who have been out on the front lines, anyone who's been out there and worked at some of these short-term COVID rates. What was your experience like? I've seen a lot of podcasts and news stories and stuff of, like Katie Duke on Instagram. She's a popular nurse practitioner, and she took a short-term contract back when the pandemic was first happening, and she got COVID during the contract and was still, months and months later, still physically recovering from COVID and was extremely sick. And I think she would probably tell you that the money she made from that wasn't enough. And I think the stress and the anxiety she dealt with for a long time after was pretty traumatic. But I want to hear from some of you guys who have done this. What was your experience like? Would you do it again? What kind of hours did you work? What kind of work conditions did you have? Do you feel like they're paying you enough? These are all things that I don't know firsthand because I work in a different field. Anesthesia, of course we have our own risks sometimes, but it's definitely not like bedside ICU nursing and COVID patient. Anyway, I want to hear from you guys down below. If you're trying to get into CRNA school, like always, join over in the memberships and the community tab over there. There's a bunch of different levels of membership depending on what level you're at, and whether you're just somewhat interested in doing CRNA school, or if you're like about to apply or about to interview and you want one-on-one mock interviews, I've got that option over there for you. Hit that subscribe button, smash that like button, explode that like button, and that's bolt out.